Hello Wave Country, I'm John Ramsey and we are live and on location at Calospa Rejuvenation Center located on Lime Kiln Lane. We're going to talk about some exciting new procedures that are available to you. To my left is the team here at Calospa, the very youthful looking team. I have of course, Dr. Bradley Calabrese is here, Dr. Chet Mays is here, and a couple of new additions as well. We have Lacey McCauley and also Caitlin Hicks, who are a new members of this very professional team. All right, before we get to what our focus is today, I want to do a little catch up. First of all, I'll go to you, Dr. Calabrese. I know you've been traveling once again, right?
I've been traveling a lot. So yeah, you know, it's a busy year for me, being gone internationally a lot. Just got back from Sweden, and coming up in the future I have Russia in October, where I'll be doing live surgery at that meeting, and I go to Israel in November after that, so as well as many meetings around the country. So I probably had 15 or 20 meetings this year, and so gone a lot and traveling. So unfortunately for Dr. Mays, while I'm gone, he has to hold down the house and all that's happening here. So, you know, I'm usually mostly gone, unless it's international travel, just for a long weekend for meetings and stuff. So,
but isn't it nice though to be recognized and celebrated and looked to as an authority around the globe? That's kind of nice.
I'm not sure if I'm celebrated. That make a little higher further than it is. Somebody has to do it and do those things. Yeah. So you know, I definitely have that place in the plastic surgery world where, for whatever reasons, you get noted and then start to speak, and you're capable of speaking and lecturing and stuff, and you become an expert at the area. And I think it's sort of, you grow with it, and over the many years you become better and smarter at it. You know, currently I'm writing a textbook on breast surgery that is going to be about 500 pages, and it's long, and so it's arduous. So that's sort of another endeavor we're doing, and Dr. Mays is doing some of that work with me and stuff. So, you know, I think, you know, being an educator has been a huge part of who I am within the practice and outside of our practice and stuff. So we just had a preceptorship this last week. We have a lot of plastic surgeons come often and watch me do surgery and get some lectures and just see what we have to offer here, which you're going to see today.
Yes.
We're going to show you a little bit more about what's here at Calospa.
Yeah, for the purposes of this show, I'm glad you're an educator, because we're going to be educated somewhat on some of the new procedures and equipment that is available here at Calospa. Dr. Mays, wanted to talk to you a little bit. You and I had a brief conversation. I know apparently you two, your trips kind of overlapped a little bit in Sweden. Is that correct?
Right. Like, he's always traveling year-round, and I had the opportunity to go to Sweden this year for a breast conference and see some of the practices there in Sweden and see how they do plastic surgery there versus how we do it here. And it's very similar. A lot of the techniques that we do here, they do there, and we learned a lot of new concepts they learned new concepts from us, and we learned new concepts from them, and just seeing how they interact with their patients. And everyone spoke English, so that was great too. There was no communication barrier.
Yeah, so, you know, I like to go to Australia because, you know, we do speak the same language, and I just say, hey, mate, or something like that, and that's as far as I have to go with that sort of concept. So we were actually in the air exactly going the opposite directions across the ocean. So right as he was flying back, I was flying over there and stuff too. So we really had Calospa represented for well over a week to 10 days in Stockholm, Sweden.
Well, if you would please, you have two new members of your very professional team again here at Calospa Rejuvenation Center. If you would do the introductions here, and perhaps we can ask them exactly what they bring to the table here at Calospa.
Yeah, of course, I'd be glad to. We're very honored to have new members always. The team's always growing, but we have two new candidates here, and this is Katie Hicks to my direct left right here. She's a nurse practitioner with actually over 7 years of experience. So these aren't new into the cosmetic and dermatology world. They have experience. So she has at least 7 years of experience prior to coming here. And then next to her is Lacey McCauley with also 7 years of experience. And feel free to correct me if I'm wrong with how much experience you guys have, because everyone always looks at me as like, oh, he's the young guy. I was like, well, I've been doing this for 8 years, so I don't know why you say I'm so young, because it feels like you put so much time and effort into where you are, and you actually have a lot of experience, and we're very honored to have them as part of our team.
Well, Caitlin, I'll ask you first. You're a nurse practitioner, correct?
Correct.
Yeah, if you would, tell me your area of expertise and exactly what are your duties here at Calospa Rejuvenation Center.
Sure. So I have experience in dermatology and cosmetic research and practice. practice. I specialize in BioT, microneedling, injectables, Botox fillers, those types of things.
All right, well, welcome aboard.
Thank you.
All right, and Lacey McCauley. Now, Lacey, you are, from what I understand, a physician's assistant, correct?
Yes, sir.
All right, welcome aboard. And exactly what do you bring to the table?
So, like Dr. May said, I have 7 years of dermatology experience, so I have a pretty extensive knowledge of skin, so I'm excited to be on board for products. And then cosmetics, fillers, Botox. So, yeah. I'm excited.
So I think, why we have added a nurse practitioner and a physician's assistant, in addition to Bethany Shively, who has been with us, who's a nurse practitioner too. We now have 3 mid-levels to add to the 2 physicians, because I think that me and Dr. Mays get so busy in the operating room and stuff, it's hard to represent ourselves over in the spa side of it. And so we really wanted to make sure we brought in people who had a lot of dermatology experience, plastic surgery, cosmetic experience as mid-levels to really guide and bring our level of care even higher. That, we really want to put safety as the premier importance in a facility like this, and really bring the expertise that a place like this can actually offer. And you're going to see some of the technology we have. And with newer technology and more advanced technology, we need people who are prepared and are professional and have done a lot of training and experience for that. I think where I've seen the spa world go around the country, not just in Louisville, has been this tendency towards a lot of little shops opening up and a lot of people trying to do injectables with minimal supervision, right? We feel very strong in the country, and myself as well, that really these techniques, these difficult lasers, the injectables, fillers, Botox and stuff, really need to be done under the purview of a good board-certified plastic surgeon or dermatologist, or somebody highly qualified in the area. And so we're doing that by even bringing on more mid-levels and really upping the game to say, let's keep this as safe and get as natural results as we can, make good decisions for patients so they can always feel comfortable coming here, that we're going to give them the highest level of care.
Been very excited about coming here to Calospa Rejuvenation Center, because from what I understand, a little bit of a tease here, we're going to see some of this new technology and exactly what can be accomplished. So if you would, maybe just a little quick overview, Doc.
Yeah, so we're going to show some of the lasers. A lot of times we talk about things here and there, but it's hard to get a sense about what it takes to actually have a sort of a world-class medical spa, which we're not really a day spa, we're really a medical spa. And with that, we're going to be showing some of that technology, show you the lasers we have here. We're going to have some examples of we're doing new IV hydration, we do hormonal therapy, we have something new called M-Sculpt, which is going to help tighten the muscles and melt the fat as well. And so we're going to use cupping as a sort of massage technique. A lot of the athletes are using the cupping technique as well. So we're just going to give you, and there's another thing called Althera and Profound, which are for facial tightening, skin tightening, really advanced technology. We've all got them here at Calospa. So we're going to show you some examples of them being done, as well as the technology.
All right, it's pretty exciting, so hang with us. Once again, we're coming to you live from Calospa Rejuvenation Center, located on Lime Kiln Lane. You're going to take a quick peek here at some of this new technology coming up next on Wave 3 Listens, and yes, we're live.
When you wake up, you expect to know what's happening around you, especially when it impacts your family and friends.
9,000 barrels of bourbon collapsing.
Every morning, get the breaking news you need to stay informed. We have a lot of other news coming at you here this morning.
That means you're going to pay more for more things.
Live, right now, everywhere you are.
Live music and plenty of family fun.
This kind of news comes out, you got to check Twitter and see what everyone's saying.
Here's some things you need to know before you walk out the door.
Expect more right now on Wave 3 News Sunrise.
A message from attorney Michael Sullivan about disability benefits.
So you applied for disability and got denied. You probably don't know it, but your doctor charts everything. Your innocent comments, they can create gaping holes in your case. Don't fall into the hole. Let me look at this long before you go to court. Case evaluations are always free. Call me now. I'll work with your doctor to plug the holes in your case.
Call 1-888-587-0228. Call now.
Win a house, help a child. Hi, I'm Shannon Kogan, here to tell you about Norton Children's Hospital's raffle. You could win this home in Norton Commons or a 2018 2 Series BMW convertible from BMW of Louisville and $10,000 cash. This year, if you buy your ticket early, you have the chance to win these additional prizes during the monthly drawings. You could win it all. Tickets, just $100. Call 559-KIDS, visit home and BMWraffle.com, our open houses, or these sponsors.
Welcome back. Calospa Rejuvenation Center, located again on Lime Kiln Lane. And we talked about new technology and the educational component of what happens here at Calospa. Dr. Calabrese and Dr. Mays are going to do a little bit of the play-by-play here. So, Doc, to my left is a lot of this new technology. I'm going to let you kind of, if you would, explain what each one of these machines accomplishes.
Yeah, so as you go down, it's just really new technology here, and we're going to show some other examples. But what we're not showing today is a new technology which is profound, which is for facial tightening, acne scarring, texture. It's this one here. This is using microneedling mixed with radio frequency. One treatment that treats it, which is great, is for that. Mirror Dry, which is the next one, is for armpit sweating, which is really great for that. One treatment in most patients, 80% of patients, it resolves both the smell and the extra wetness that occurs in the armpit. So great. Think of a bride who has those problems and stuff with it, or athletes. It can be very, very helpful. Yeah, and Dr. Mays had it done, too. Yeah, he wasn't very brave, but he did fantastic, for sure. Infini, which is a skin tightening procedure, which is microneedling with radio frequency, and it takes 3 treatments for it. And then the other 2 are pigment ones that we use for both tattooing, but also removing vascularity, pigmentation. It's really for the complexion of the skin. So you think about the readiness that occurs in the skin, the vascularity and pigment. We treat them with both our XLV and our Spectra laser for that. Over to the other side, which you may not see, way over to the side, is we have laser hair removal with the light shear. We also have Pronox, which is a sedation. It's like laughing gas that we use to help people be comfortable. Hydrofacials are extremely popular. They're the most popular treatment that we do. Easy. There's no downtime. It's a good water-based hydrofacial that really almost water blasts the face into health. And then Selfina, which we see in the back, is actually for cellulite treatment, and it's very, very effective with that. In addition, we have Cool Sculpt, where we melt the fat away, and ThermiSmooth for cellulite treatment as well. And then we have treatments that are going on here.
All right. Yeah, I wanted to ask you, Doc, before we move on over here, about the vetting process. Obviously, being a state-of-the-art medical spa, you're approached by a lot of different companies. Is it all about results? Is there some kind of trial period? Exactly how does it work for you and Dr. Mays?
Well, yeah, I wish there was a trial period, and for any vendors out there, please let's do a trial period. That would be fantastic.
That doesn't happen.
Yeah, so no, I have a unique advantage because I traveled the country, I've traveled the world, so I've seen this technology for a long time as it starts to get presented at national meetings. Even though I'm not presenting on it, I'm hearing in the presentations, and I have all my colleagues that I work with around the country, so they buy the technology. So I wait until they've vetted it out and make sure that it's a technology that actually has a lot of validity to it, and they're seeing results. And actually with the Profound, recently, and therapy, I started calling surgeons around and saying, what do you think of this and that technology? And once I get their advocacy that it's actually effective and it actually works, then we go ahead and purchase it and go with it. So I think it's really important. That's the hardest thing. There's a lot of technology and it doesn't always work, and so you want to make sure that and then it's not just the technology, but it's how it's done. So we believe here in centers of excellence, which means we want to make sure that when we treat it to its fullest impact. So what you see here is an oral therapy, which is basically just a one-time treatment for facial and neck tightening. It sort of lifts things up, and you make the patients comfortable. We can use Pronox, laughing gas, as I mentioned, to make them comfortable with it. But you see, it's very, very well tolerated, and we treat the whole face, and it's through ultrasonic energy. It will actually tighten the tissue with it. So very easily come in, no downtime. You can go to work the next day with no problems. Those are the kind of technologies we like. Over here, I got Nikolai getting IV hydration. This is new to our practice of really having IV hydration for recovery from athletics, from recovery before and after surgery. So this is great. We'll give people hydration before their surgery, like a couple days before, and after their surgery for a faster recovery. But also, you can imagine athletes who want some vitamin boosts, and so we have a lot of therapies that we can provide for that.
Is it possible for me to get the hydration and the laughing gas? Because I think that sounds like a lot of fun.
Well, people don't like IVs, so that may be necessary for those who don't like IVs, I think. But in general, it's very easy to come in and get some hydration and get some boost. And we also give shots of B12 and things that will actually melt fat, which can complement our other treatments.
All right. Dr. Mays, if you would. Okay. what is going on over here? This is M-Sculpt, is that what it's called?
Yes, M-Sculpt, which is sort of electromagnetic. And I don't know if you can get close enough to actually see, Malia here is actually having her abdominal muscles flexed many, many times, higher than she could ever flex herself. So the ultimate contraction. What this is doing is stimulating muscle development and growth, and also burning fat at the same time, which is the only device that actually is doing that right now, is actually stimulating muscle growth and burning fat.
So, yeah.
And then Brooke is the one running the machine right now. Brooke, would you like to add?
Yes. Yeah, Brooke, if you would. What are we seeing here? This looks really complex.
So another great thing is for a lot of moms who have recently had babies, it also reduces diastasis recti. So where that abdominal muscle separates, it helps to bond that back together. So this will be very beneficial for mommy makeovers.
And it also does butt lifts. So actually we have this device can also be placed posteriorly, and actually through the contractions you'll see a nice little lifting that happens with the buttocks area, and that can be a really hard place to treat. And so we love something that offers something for the patients other than just fat grafting.
And you're looking at some before and after pictures now. Wow, this technology is so far over my head, but it is fascinating, and I am certain with this kind of technology, does it excite you, doctor, about what can be accomplished that is really rather non-invasive?
Well, let me just say, the older I get, I determine what technology we get based on what I need, right? So, personally. So, you want that muscle to be tighter, and you want a little less fat the older we get. I know you don't know anything about that, John, but I'm experiencing it. So we like these technologies because it resonates with me, because the things I'm struggling with, I get it now. I didn't get it as much at 30, but now I get it. And if anything we can do to help, and really, this is like doing 10,000 sit-ups, to 20,000 sit-ups in 30 minutes, right? Wow. And I mean, I can do them almost that fast at the gym, but not quite. So that's what we love about this. It's fixing the muscle in a way. We've always melted fat, done things with fat, but we haven't done anything for the muscle. And this is another whole way to sort of just improve the overall aesthetic result with somebody without any surgery, which you're exactly right.
Yes.
Right. And then the latest, which I think most people know something about, which is the concept of cupping. And we have a lot of our providers that do not only do massage, but they do very therapeutic, and they had a lot of training. It was a very intensive, like 16 hours of training just to really be certified in this cupping technique. And this is really good for athletes. I think you remember Michael Phelps when he did, right? And he had and so we see a lot of people using cupping as a recovery technique for muscle strains and pains and everything else associated with it.
Wow. Yeah, what it seems to me is it kind of rushes blood into the injured area or into the area that you want to recover quickly. Is that, I know that's very shallow and basic, but is that basically it?
No, I think that's right. I think it's actually that, and it's enhancing that. I'm sure there are things that it's doing that we don't even quite understand why the body works and why it does that with it. But everybody seems to get improvement from it, and that's what I think is really, really nice. It's not like one of those, gimmicky type of treatments. It's actually very therapeutic, very scientific. They teach it like a scientific course to really learn this technique because we really want it to work.
Wow.
Right? So.
Okay. So much information in such a little amount of time. So if you have a question, 571-5263, Dr. Mays or Dr. Calabrese will be happy to answer your questions. Again, give us a call. Again, we've got cupping over here. As you can see, her waist is about as big as my fist, and it took 2 minutes. We've got hydration going on over here. We got tightening of the face and neck. So all of that is available. This is just some of the procedures and some of the new technology available at Calospa Rejuvenation Center. We're going to take a quick break, and we'll be back. Limekiln Lane is the location. Calospa Rejuvenation Center.
We've got your Toyota at Toyota of Louisville. Hi, folks. I'm Tim Jones. Here's an update during the summer sales event. If you need help with a down payment, brand new Highlander, you can get $1,750 customer cash back, but you've got to hurry. ToyotaofLouisville.com.
In a perfect world, I wish I just had the ability to bring these clients in and find a way to put them right back to where they were before the accident happened. But what we do is kind of the closest we can to do that. We want to make sure that they're not kicked out of their home or not able to pay their light bill. We want to try to get them that wage loss ASAP. Our goal is to make them feel like their lives have been changed as little as possible knowing that they're dealing with a very life-changing experience, and to accomplish that feels pretty cool.
Attention, this weekend, Zero Down delivers any car, truck, SUV on the pre-owned lot here at Toyota of Louisville, and we want your trade. We offer second chance finance, toyotaoflouisville.com.
Welcome back once again, Calospa Rejuvenation Center. We've taken a look at a lot of new technology here. It has been fascinating. But I think the ultimate goal here, Dr. Calabrese and Dr. Mays, is the fact that with all of these options, whether they be surgical or non-invasive, some of this new technology that we see here, it gives the patient options where you, as you said, then you can be perfectly honest with what is best for the patient, right?
Yeah, I think with plastic surgery practice like this is fully equipped to give them the whole range of options from non-surgical to surgery. So I don't have any vested interest in whether somebody decides to do M-Sculpt or Cool Sculpt or decides to get a liposuction or tummy tuck. I'm going to do what we think's best for them and what's going to deliver the results that they're looking for.
Right.
Yeah.
That makes perfect sense. So when you have a consultation, perhaps you want to know, first of all, what are the expectations? What are you trying to accomplish? Yes. And then you guys can take a look at, hey, this is what we think will get you to your goal, right?
Right. Just to get to that consultation, there's a lot of information that gets exchanged between the patient and our office. And by the time I walk in the door with a new patient, I know sort of why they're there. They've already seen my staff and sort of give me a heads up. That way I can really focus in on what it is that they're seeking treatment for. And that's the beauty, like Dr. Calabrese said, is being in an area where you have the Medi-Spa that's results driven. You have the surgery center. You have plastic surgeons. You have mid-levels. You have nurse injectors. You have all these people that you can sort of direct them to based on what they need. And if you don't have that, then everyone's only a candidate for that one thing you have. If you only have Cool Sculpting, everyone that walks in your door, you're perfect for Cool Sculpting. Whereas when you have all the devices here, you have the surgery, you direct the patient down that pathway that's best for them to get the best result possible.
That makes perfect sense.
And have the level of care to what a patient's comfortable with. There are patients who really just want the physician to do their injectables for them, and of course, me and Dr. Mays both do that. Some people feel comfortable with a nurse practitioner or a PA or even a nurse doing it based upon their comfort level. We want to have all the ranges so we can deliver for the patients the care in the level that they want it to be. And so we have all those to provide for patients. So, we really want to carry it across the board for them and bring the highest level of professionalism that is mostly focused on safety.
All right.
These have to be all done safely, or it doesn't matter about any of it.
All right. Again, we've asked if you have questions, and I think we do. I think we might want to throw that earpiece in there, Doctor, and so we can hear the question. But Diana has been nice enough to call us. Diana, welcome into Wave 3 Listens, and you have a question for Dr. Mays or Dr. Calabrese? Hello, Diana. I am not hearing Diana.
I'm not hearing Diana's very quiet.
It's okay, Diana. 571-5263 if you have a question. So we're gonna jump off here real quick. I want to ask about, as far as who is a good candidate for the procedures that we just talked about. For instance, talked about tightening of the face and neck. This is male, female, anyone who just feels like they have a problem area, correct?
Yes, people like me, right? Yeah. So yes, no, it's for females and males. I think it's for the person who isn't ready to have a facelift or another type of procedure, has some signs of facial aging, wants something where there's no downtime, they can't take time off work yet. Maybe there's a wedding or a holiday coming up, something where they want to look a little better and it gets some improvement, but they're not expecting a facelift result. They're expecting improvement. That's who it's a perfect candidate for. So if you're not ready, but you want to see some difference, definitely, you want to see a difference, then that's who it's for. The profound would be for somebody who has a little downtime. We don't have an example of it, but it's going to be where we're doing some microneedling. So they're going to have some needle points. So it takes about 4 days to heal from that, but it's going to also be just one treatment with a pretty profound result.
Right. And just keep in mind, some of these treatments, it takes months to see the effect. So some of these things, people, if they're looking for a quick fix, we'll have to direct them down that pathway. Like say they have an event next week and they want rejuvenation. We're not going to do the old therapy because it might take 2 to 3 months to see the final skin tightening or something. But once again, that's the beauty of this place, is we have many options for whatever the patient's looking for.
Yeah. So Doc, for folks who have watched and said, okay, I'm interested in one of these procedures, or I'd like a consultation and really be educated about my options, recommendation, give you a call? How does it
just make a call, and sometimes they're going to see the plastic surgeon if they're thinking about more surgical options, and sometimes they'll see one of our nurse practitioners, or our PA, or our nurses, or our estheticians, based upon what they're asking about and who's appropriate to see them for that consultation. And a lot of these, for these new technologies we have coming in, We usually offer complimentary consultations so they can get the information they need. We're not going to do a treatment that first time. We want to see them, evaluate them, and choose the right procedure for them. And so that takes a little bit of conversation, a little bit of time, you know. And like M-Sculpt, muscle tightening, who isn't a candidate, right? You know, if they want to spend the money for it and they want tightening and improvement and lift or flattening, yeah, everybody's a candidate for that if they want it, you know, and unless they have a pacemaker or something unique, they're actually going to be a great candidate for some of these things. Other things, it's really mostly about managing expectations. You know, with non-surgicals, you tend to get less of a result than you actually get with a surgical procedure, but you have no downtime and less risks associated with it. So it's finding out what's the right path and the right place for each patient.
All right. Once again, if you'd like a consultation, give them a call here at Calospa Rejuvenation Center. And I think going back to where we began, all of this travel, all of this education, going to Sweden, to Russia, wherever it may be, it all benefits the patient here in Louisville, Kentucky, which is fantastic.
Right, yeah. And I see my staff sort of lining up the stairs here. So we were just going to give you a little picture, if you turn back around that way, of, you know, all our staff members. We have a large crew here. So we have about 55 staff members who help take care of all of our patients. So it's not really done alone. It's really through the spa, the surgery center, and in the plastic surgery side. It takes a lot of people because we want to give the highest level of service and care to our patients, and that requires a lot of people to do that. And so we're here to serve our clients and our patients in the best way we know how, through our technology, but all through our care and our service.
All right, you guys look fantastic. A little wave, if you would, please. All right, we're going to take a little break, and we'll be back. Coming to you once again from Calospa Rejuvenation Center.
I'm John Morgan. If you've been injured on the job, call Pound Law from your cell phone. Morgan & Morgan. Pound Law, that's all.
Sam is amazing. He has amazing staff. I'm just all around happy about coming here and choosing Sam Aguiar as my attorney.
My name is Rose. Smoking caused my lung cancer. I was on chemo and radiation. They took part of my lung out, and they put this in me to drain the fluid. Every day I prayed that they would remove it. My tip is, be careful what you wish for. That chest tube hurt a lot more